You're on TRT, but the biggest question remains. Is this forever? How long is long enough? For decades, men feared TRT could harm their heart. A landmark study has now reversed that belief. This new data showed no significant increase in heart attacks or strokes for men on treatment. But that same study found a surprising uptick in one condition: atrial fibrillation. The story is complex. We'll break down the true long-term gains, the proven risks, and give you the framework to answer, how long for you? First, the default position. For men with a confirmed chronic deficiency, TRT isn't a temporary fix. Medical consensus views it as a lifelong therapy, much like managing thyroid disease or diabetes. So what happens if you stop after years? You face the hormone crash, a sudden return of fatigue and depression. This happens because injected testosterone shuts down your body's own production. Stopping leaves a hormonal void. Getting your natural production back online isn't instant. It can take weeks, or often many months, to recover. The decision to start is significant because stopping is a difficult, prolonged process. This makes long-term effects matter. Given that commitment, what are the proven long-term benefits? Let's look beyond muscle to systemic advantages. One of the most powerful effects is on your skeleton. Testosterone is foundational for maintaining bone mass. The results are measurable. Long-term TRT increases bone mineral density, compounding over years to lower fracture risk. This isn't just a number. It's the difference between a minor fall and a life-altering fracture in your 70s or 80s. Beyond the physical, the therapy affects the brain, showing long-term improvements in cognitive speed and memory. TRT also fundamentally shifts your metabolic health for the better. It helps build lean muscle and reduce dangerous visceral fat. This change improves insulin sensitivity, lowering type 2 diabetes risk, and can lead to better cholesterol profiles. Now for the myths. Feared TRT caused prostate cancer? That idea is from 1941. Modern studies show it is false. The opposite might be true. Some data suggests chronically low testosterone may be linked to more aggressive prostate cancers. Another myth: TRT worsens urinary issues. Again, studies show this isn't necessarily true. Some men see improvement. So the greatest historical fears surrounding long-term TRT, especially for the prostate, have been largely disproven. But if heart attacks and cancer are not the main concerns, what are the actual long-term risks you must monitor? The first is non-negotiable: fertility. TRT acts as a male contraceptive, often reducing sperm counts to near zero. While often reversible after stopping treatment, that is not a guarantee. Long-term use can permanently reduce fertility. Next is your blood. TRT can elevate your red blood cell count, thickening the blood. This is why regular monitoring is mandatory. Finally, sleep. If you have or are at risk for sleep apnea, testosterone can worsen it by affecting airway muscles. We've seen profound benefits, disproven myths, and real manageable risks. How do we put this together? Recall that TRT is often lifelong. The new cardiovascular data makes this commitment a much safer proposition than a decade ago. TRT is not a magic pill against aging. It's a medical treatment for a diagnosed deficiency, not a lifestyle supplement. So the duration isn't a set number of years, it's a continuous assessment. As long as benefits exist and risks are managed, it goes on. And there's a clear off-ramp. If you achieve optimal hormone levels but see no real benefit, the therapy should be stopped. So, how long should you be on TRT? For the right person with clear benefits, the answer is often indefinitely, with medical oversight. You are trading manageable risks like fertility impact for profound long-term gains in bone, brain, and metabolic health. The decision to continue TRT is not passive. It's an active, ongoing partnership between you and your physician. Use this information to have a more intelligent, informed conversation with your healthcare provider. Your long-term health depends on it.